Todd, great to have you on the podcast.
Thanks, Jared. Good to see you.
First time coming on. So, usually, what I like to do with first time guests is have them tell me a little bit about their background, and then we'll hear kind of your overview of Accuryn and just have a casual conversation here today.
Thanks. Oh man, maybe the background's my healthcare background. I have worked for McKesson, Siemens, and GE. And after leaving GE, I actually joined Intermountain Healthcare as the first person with innovation in their title of Intermountain Healthcare as the director of innovation. Stayed there for a number of years, and that's really where a lot of my learning around the kidney and that journey started. I was very much focused on meaningful material impact in the context of care. That's what really drove our innovation efforts, is really understanding what was happening on the front lines. In early 20, yes, very interesting time, I joined Atrium Healthcare to help lead innovation there. And that is where I actually became a customer of Accuryn, which is a really interesting story as part of my journey to now being the CEO of Accuryn. So that's a really high level, quick thing. My master's is actually in supply chain management. And so I have a really interesting balance for my brain between relentless ops for the first half of my career and then gratefully being able to manage and marry that with innovation.
I loved seeing, I mean, we still see this at a lot of companies, right? But you had another role at Accuryn and then you transitioned into the CEO role. What was that transition like? And talk me through this is obviously, and you'll be biased on this, and that's totally fine. But like the value in promoting from within to that CEO role based on what you already knew about the company and your involvement before, because I think we still see that a lot. But I see so many companies going outside, and sometimes I disagree, and not all of them. I agree with some of the moves, but promoting from within because of the knowledge you already have, I think seems like the best play for many companies. But would love to hear your thoughts.
That's an interesting angle. Because I was a customer of the company, meant I was also a customer of the problem. And so we did an enormous amount of work doing observations in ORs, intensive care units, just understanding the journey of the inpatient kidney, which put us on a hunt to find a solution for doing a better job with that particular organ and that particular procedure. And so my journey as a customer started in late 21. And I think to your point, Jared, it gave me insights that someone from the outside couldn't really understand, from what does the problem feel like and experience in an OR and ICU? What is a buying process of a healthcare system? Because in my innovation role, I met with 1,000 healthcare startups over 10 years, without a doubt. And so I think that perspective, understanding the heart and vascular business model, understanding what the front line went through, gave me a really unique perspective. And then for 7 years now, I've been a member of the Healthcare Innovators Professional Society. It's a group of 33 of us in strategy or innovation roles, transformation roles. And we have been sharing insights and learnings for years. And also, to some degree, that gave me a gift of knowing so many different hospital systems, how they drove innovation and transformation. And then, to your point, I consulted with Accuryn last year, gave me really good insight into how the company was run. And then in February, the board asked me to join as to lead transformation. So I think that really good perspective you bring with that question is I had the customer side of it, and then I had the consulting side of it to understand. So I think all of that knowledge and knowing so much about the industry and so many people set me up pretty good to be a part of the team here.
Would you like to see maybe other companies follow a similar path like that, from promoting from within and also bringing on someone to lead the company that was also a customer?
Yes. And I don't want it to come across in any way as arrogant about me, or I don't want to lean that way. What I would say is one of the hardest things to ever understand is how a healthcare system works if you haven't been in it. And a lot of these early stage companies do an incredible job of developing their product, what have you, but a tangible, deep understanding, even an empathetic understanding of what clinical teams deal with to do all they can to take care of patients, and then what hospitals deal with when the financials are like they are now helps inform decisions and also helps an internal team that's never been in a hospital feel what the hospital feels and understand from the customer angle exactly what happens. And so I think it's a really good move for companies at certain stages, Jared, to bring in someone who has a really deep understanding of the inside of a hospital and even maybe more beneficial on top of that, an understanding of the problem and the product. And I was just fortunate enough to have both.
When you think of, I mean, I know there's probably a lot of areas you could mention here, but when you think of Accuryn, what do you wish customers and just outsiders in general knew about the company that maybe they don't know?
That's a great question. I would, if it's okay with you, let me start with the problem.
Let's go with that.
And because then that'll help me explain really why I think this is so important. Yeah, as a data source. And I was speaking with them the other day, and they mentioned that in 2024, 3.4 million acute kidney injuries were diagnosed using what we know today as the standard of the serum creatinine test, which is really lagging. It misses a lot of AKIs. That's one every about 10 seconds. So I think we need to shed light on the enormity of the problem. Alexis Kaiser and others have done research on this, Newsweek, that it's a 10 to $24 billion problem for the healthcare industry. That's a really big problem. It's also a problem for patients because one bit of research I've read is that 37% of people who get diagnosed with an acute kidney injury in the hospital wind up actually having chronic kidney disease, which is, you get episodic to longitudinal problem, and that's not good for the patient, their family. It's not good for the industry. Not one doctor or nurse would ever wish that on a patient. The thing I would want them to know is a little bit of a contrast, Jared, that most people don't know. If you look at the head of the bed in an OR or the ICU, I kind of call it the bunker because I had the opportunity to stand inside the bunker watching a double valve replacement and a bunch of surgeries with some of my surgery and nursing friends. You know everything about the heart, brain, and lungs that you need to know. We absolutely monitor the vitals in the OR and the ICU of those vital organs. And then you ask the question, what do we do for the kidney? And a lot of people say, that's a great question. Well, we use a gravity fed Foley catheter that actually got patented and named after Dr. Foley in 1936. So it's a tube. It has a dependent loop in it, and it makes the management of urine output completely manual. The thing that, and by the way, urine is the vital sign of the kidney, but yet we use basically a 90-year-old functional design solution to help manage it. I don't think that's fair to the doctors and the nurses. And then to know if your kidneys are in distress. So if your heart rate's out or if your oxygen stat is out, we know your other vital organs are in trouble because that's their vital signs. But for us to know if your kidneys are in distress, we use a serum creatinine score, a lab, and it really lags the vital sign. And the reason that I bring that up is that when you look at what we've given clinical teams to take care of your kidneys, it's so underserved compared to the heart, brain, and lungs. So what I would want people to know about Accuryn is we've really solved the problem. I refer to it in a couple of ways. I say we digitize the kidney just like the heart and lungs have been digitized. So we have a catheter, but it happens to be really smart. We automatically move the urine and we automatically measure it and we put that back into the electronic medical record. But we also have a device that because you know what's going on with the urine, the vital sign, we can also tell you kidney distress, acute kidney injury based on a global standard. The global standard is kidney disease improving global outcomes. So we use your vital sign. We use a really smart catheter versus just a tube. And we give the clinical teams really early warnings of kidney distress, 12 hours ahead of the blood test, actually, even for stage 1. So I would want them to know that we really transformed kidney care. We've digitized the kidney. We've automated urine output. We've automated continuous intra-abdominal pressure. We give alerts either at the bedside or in the electronic medical record about acute kidney injury. And because we do that, we can help prevent deterioration of the kidney if you use the information that we give you, just like if you didn't pay attention to blood pressure, you couldn't protect the heart. But that's what we do. It's just such a contrast between what I would consider the outdated methods of taking care of a vital organ today compared to what we give.
Super interesting. When you kind of going back to, I probably asked it too early, and I'm glad that you explained that.
That's all right.
I talk with like so many great companies, right? And this is not a knock on anyone's business, but there's always things. It's funny when I bring on the executives that they wish customers knew that maybe is not totally clear. Is there anything that you want to share today with any customers or any outsiders listening that maybe this is not something you know about Accuryn, but it's true?
Well, the one thing I would want everyone to know, Jared, is it's basically a template. I would want the system to use the AKI codes, N16. There are 5 codes in N99. Just assess how many of those diagnoses you had with the blood test, which, by the way, misses a lot, but you still have a big number. And what I would want them to do, because I deeply care about the financial viability of a system too, is look at the length of stay related to those, look at your readmit rate, which is really big, especially in the heart procedures, and look at how many of those escalated to dialysis, because you already get in trouble with length of stay, especially with capitated payments. Readmit rates you don't get paid for, especially in the cardiology space. And with dialysis, if a patient comes in not having dialysis present on admission and they escalate to it, you really get a bad quality ding. And in some contracts, you don't get paid for it at all. So that's what I would want them to do, is just to be aware of their own problem, because in every problem, there's an opportunity to transform something. Shine a light on it. My opinion is every hospital system cares deeply about you and every patient that walks through their door. I think sometimes putting a number to it to know, like, oh my gosh, we had 31,000 acute kidney injuries last year, starts bringing that into the human perspective. Those are 31,000 people. And then when you look at the financial negative outcomes to that, it's a big deal. And then I would say one more thing: do research. Go into Chat GPT Pro and say, how much money is our system possibly losing because we under document acute kidney injury? So you have the cost side, length of stay, readmit, dialysis. Then you have revenue side. If it doesn't get documented, it can't get coded and properly paid for. And we all know the documentation burden on nurses and doctors is unbelievable. It's why you see so much ambient technology is to help with that. Well, we can automate the management of urine, and other types of notes are automated. So I would have them look there first, understand the problem first. It's always better to diagnose before you prescribe.
I like it. Todd, as we start to wrap up here, usually we make these quick episodes and I appreciate
Yeah,
you coming on.
no, that's great.
What's next for Accuryn that you want people to know?
Really, what's next for us is continuing to partner with systems. What I would really like the industry to see, and this is part of what's next for us, is to create a much better awareness of the negative impact of acute kidney injury clinically, financially, for patients, systems, and the industry as a whole. So we're going to stay on this very passionately. We deeply care. I often say we're protecting kidneys one patient at a time. So we can't lose that. But at the same time, Jared, it needs a light on it. It's just like Caudy got a big light on it. We need that same type of light on acute kidney injury. And CMS, back in August of last year, actually declared acute kidney injury as a hospital harm. And so that is beginning to happen. But what's next for us is just to keep accelerating, giving clinicians the solutions that they need to take care of you. We get that right, everything else will be better.
I love it. Todd, I want to thank you once again for joining me on the podcast. Let's definitely stay in touch, but thank you so much for joining me here today.
It's always good to see you, man. And I'm really honored you would invite me on to have a little slice of healthcare discussion.
I love it. Until next time.
Thanks.